We want to introduce you to a very special young patient of ours. This is Siana. Siana came to us when she was about 3 months old. Her parents brought her in. Beautiful young girl, healthy, happy. You know, parents of course are just head over heels in love, but she had a problem. So Siana was born with what's called a unilateral cleft lip deformity. And basically this results in a hole in the face. And so this happens because during development, for one reason or another, her face didn't quite come together. And so it arrests, we call it. And so if it doesn't quite come together, that leaves an incomplete cleft in the face, and that acts as a hole. So the lips aren't able to suction, she can't kiss. If she smiles, the lips pull apart. So while she's young and doesn't have any concept of this now, if this persists, this will damage her life, you know, sort of unspeakably. Luckily, there are techniques that can fix this and can essentially erase this from her life, but you have to be quite subspecialized to do that. And really in this Caribbean area in Colombia, there are no centers that really provide, you know, what we call excellence in comprehensive cleft care. So, you know, we have a foundation, it's called Premium Care Kids, and it's devoted to these children and their families. We believe in the power of a smile, and that if we can take our experience and our resources and focus them towards what we call 5-star cleft care, we can take these kids with these big problems and we can affect treatment and fix them. And that's what we want for these kids. And so we are here for these kids that come from all around for treatment, and all of it's absolutely free. So about 2 months ago, Siana was taken to the operating room for surgery, but we had a surprise in that her veins were small and she was nice and fat, you know, which is good, she's well nourished, but we couldn't get an IV. And so we had to halt the procedure, which was quite disappointing for everybody because everyone's all geared up to get this done. But we have to roll with the punches, and the great thing about being a full-time center here in Cartagena is that we're here for Siana. So, you know, we sucked it up, we waited, we let her grow a little bit. We actually invested in another machine that helps us find the veins. And so last week, Siana came back, and she's a little bit bigger. We had this machine work perfectly. We were able to get her veins. Her parents were with her, everyone excited and geared up for surgery. So, you know, we've done a ton of these, but you know, there's a lot of nuances in these surgeries because they're quite complex. So I'm not above studying up a little bit, you know. So luckily I have a great resources edited by Dr. Campbell and Dr. Estrepo, but this is a textbook we did a number of years ago because we gained a huge experience in these subjects. And so, you know, chapter 7, an algorithmic approach to unilateral cleft lip repair, really details her techniques. And I find it even useful to go back and read our own writings to get all the nuances of this procedure. But she went to surgery, took me about an hour. You know, I was very, very happy with the outcome, with full symmetry, nose, lip length, Cupid's bow, vermilion border, which are all the elements to, you know, what we would say is excellent cleft lip repair. And from her basal view, she has perfect symmetry as well. So I was quite happy, and I was even happier this morning when I saw her back. So she's 1 week after surgery. She looks amazing. Her mom is happy. I was happy. So it is quite a joyous affair to fix these kids and essentially normalize them. She looks happy, I think. But we took her back to the operating room to take her sutures out. We have the luxury of having the surgery center here available for these kids, and certain sutures leave the best scars. So I took her back, we gave her a little just sort of sleeping medication, took those out in the operating room, and you can see this is like 15 minutes later. When she's come out of the operating room, woke up, she's dressed, she's got a little bit of gel on the lip, and she looks amazing. I mean, where's the scar? She looks perfect. This is a week after repair. So this goes to show you with great technique, with great resources, with great investment into these children, what they need is they need to be in the right place with the right professionals, employing the right techniques, and they need 1 hour. And we can erase this from their life forever. So it was a lot of fun seeing her just in the lobby. It, you know, just warms our heart. Her family's thrilled, her sister's always with her. You can just see it in their faces how happy they are. So quite touching. But I went back to the lounge and was getting ready for the next part of the day. And then they brought a box back, and it was a gift from the parents. And they gave me this coffee cup. And they put this photo of us last week before our surgery. And so it was quite touching that they had gone to the trouble to do that. And they feel so indebted. And so I appreciate them. Cheers to Siana. We love you, we love your family. We're here for you, and we're here for the rest. So thank you to everyone that supports Premium Care Kids, and we look forward to many more to come.